projects here, but we are a global health organization working in 70 or so countries, especially in the area of vaccines, digital health, as well as building resilient health systems. So that's kind of our forte in that particular area. And in today's conversation, we are talking about, what is emerging at the intersection of health and climate change. So the idea is to understand it together and come up with some strategies and solutions and innovations, which both Path and you will hear from our distinguished panelists on what they are doing in different parts of the world and how we can do it better in Pakistan. Now, Pakistan's public health scene is very bleak, if I may say so. You look at any indicator, we are one of the worst performing nations, unfortunately. 40% stunted growth. Polio, one of the few countries, still remains endemic. And on top of it, we have now climate change, which is adding floods, air pollution, as well as heat stress. So it's compounding the issues in the health sector, which we already have. Now, other than that, PATH has developed a global program in climate and health, which has 5 facets. So I'll take 1 minute. I know we are running late to use it as kind of this opportunity to talk a little bit about our program. So the very first part of the program is understanding the climate and health interaction and intersection. You will hear a little bit from Dr. Marukh in a short while of that research which is going on in one particular area, which is climate change and air pollution. So that gives you a flavor of some of our work. The second one is systems and structures, how different governments are adapting to it and how we are helping in terms of developing new governance systems for this very complex and dynamic area. And third one is vaccines, supply chains. We are helping to green the supply chains together with Gavi, Global Fund, and others. And last but not the least is the funding mechanisms which we're establishing for innovations. We have recently established a new fund together with a Global Innovation Fund, which is $120 million to invest in innovations in climate change and health. So this was launched at the recent World Health Assembly in Geneva. I'll stop here. We are very lucky to have very, very distinguished panelists with us. First of all, I wanted to profoundly thank Dr. Bhutta. Professor Bhutta is well respected, well known in the international circuit. We'll ask him to introduce himself. He's based in Canada. Some of us would know that last year he received the highest order from the Canadian government, the Order of Canada. This year was Virchow Prize, so we are very proud of him, that he is of Pakistani origin. Then Professor Dr. Iqrar Ahmed Khan, he has been Vice Chancellor in several universities, not one university, and currently the chairperson of Punjab Higher Education Commission. He couldn't be with us today in person, but has very kindly joined us online as well. Then we have two hello, Dr. Khan. And then we have two colleagues from PATH, one in Vietnam right now. So here I see Dr. New, and one in China, Dr. Marukh from Beijing. So they're joining us as well. So before moving forward, can I please request each of the panelists to briefly introduce themselves before we start with the presentations from Dr. Nu and Dr. Marukh. So Dr. Bhutta, could we start with you, your brief introduction for the audience over here, as well as some of the work which you have done in climate and health space. Over to you, Dr. Bhutta.
Well, thank you very much for that generous introduction. I'm joining you today from Toronto, but I am a Pakistani and I spent a lot of my time in Pakistan, so I just returned a week ago. I head the Institute for Global Health and Development across Aga Khan University campuses in South Central Asia and East Africa, and I also head the Center for Global Child Health here in Toronto and the Lawson Center for Climate and Nutrition at the University of Toronto. I've had a long history of working in public health in Pakistan and globally. And much of my work until I would say about a decade ago was largely focused on child survival, child health, nutrition, and development. My groups now, working in Pakistan, East Africa, and Canada, devote a significant proportion of their time now to addressing issues of climate change and human health, with a specific focus on maternal and child health and nutrition. And this ranges from not just knowledge synthesis, but also translation and a lot of intervention studies, including several large-scale trials in Pakistan to see how we can improve adaptation, resilience, and community-based responses to something that is ubiquitous and also an existential crisis for Pakistan. So thank you very much for the opportunity to join you, and I look forward to learning from many learned colleagues. Thank you.
Thank you,
Uh,
Professor Bhuta. When I joined Path 4 years ago, went to Seattle, the very first question which was asked to me was, "Do you know Professor Bhuta?" And I said, "I know of him," but this is considered a kind of qualification to join a global health organization. We are very proud of you, of your achievements, of your work, your contributions, and looking forward to hearing from you. Very many special thanks, I would say once again. We are approaching midnight in Canada, and you're with us, so it's a huge honor. Thank you. Dr. Ikrar, over to you. Please introduce
Thank you,
yourself.
Nabil, for letting me in this very prestigious session. I'm basically a plant scientist, uh, and for nearly 20 years, my focus has been food security, and that, of course, includes nutritional security. In that context, we established a Center for Advanced Studies in Food Security. And within the scope of food security, climate change has been our major engagement. And then during the course of this food security engagements, we came across a group in National Academy of Sciences in Washington, D.C. And we were introduced to One Health programs, which National Academy was running. And the hub, just coincidentally, the hub for that program is at University of California, Davis. And we were partnered with UC Davis on food security. So we were able to dovetail two programs. And then lately, we have also established a Park Korean Nutrition Center. The nutrition center is particularly focused on first 1,000 days, mother-child health. And we are not health professional. We are the ones who think in terms of preventive measures, making sure that the population is well fed. And the issue that you raised, stunting and wasting, which actually begins in the first 1,000 days. So I'm here to learn more. Also, I would like to add that in my current engagement, we have a funding arrangement for setting up 10 clusters with a hub in certain universities, and two of the clusters are actually One Health and Nutrition. We have a lot
Uh,
of enthusiasm on that.
Thank you, Dr. Khan. Really a privilege and pleasure. Many people sitting here would know you, but if I have to introduce you in one sentence, I have been following your work for a long time. That you're a person who up with new initiatives and then starts it and then sustains it. So thank you very much for joining us today. Over to
Thank
my
you. And
two
and
colleagues.
the audience are to know that you and I come from same school.
It's a huge honor.
Thank you.
So moving forward, two of my colleagues, Dr. Nu, we will start with you and then Dr. Marukh before we come here back to Islamabad. Nu?
Thank you, Dr. Nabil. Good morning. My name is Nhiêu Nguyen, and I'm the Program Director at the Southeast Asia Regional Office of PAT, based in Vietnam. My focus is on One Health, that including environment, health, and climate change. The topics really focus is zoonotic diseases, emerging infectious diseases, and AMR, antimicrobial resistance. And as you know, it's impact a lot by climate change, some of the vector-borne disease like dengue fever, malaria, and flooding that impact the waterborne diseases and such. So I'm very happy to join the panel and share some example today. Thank you.
Thank you, Dr. New. From her current position as the program director, she's soon to be appointed as the regional director for Southeast Asia region. Once again, congratulations. And I know that you have to travel to Canada also right after this program. So thanks for joining. Maruk?
I hope you can hear me. Assalamualaikum. I'm Dr. Maruf, and I started my career as a medical doctor. I did my MBBS from Allama Iqbal Medical College from Lahore, Pakistan, and then I turned to public health after doing my master's from University of Edinburgh. So after turning to public health, I've been working with a couple of NGOs on education, mother-child health. And right now, from the last 2 years, I'm working on air pollution crisis in Pakistan. And PATH gave me an opportunity to do some research while living in China on how China has improved its air quality in just a decade. So right here, I'll be presenting I'll just like a very little, like a short summary of what PATH and I have done together for air pollution crisis in Pakistan.
Thank you, Dr. Maruk. Ambassador Nabil Munir, over to you.
Thank you. Thank you, Nabil. My namesake. Good to see you again after so many years. My name is Nabil Munir. I am currently the Special Secretary of the United Nations working with the Ministry of Foreign Affairs. I have been working with the ministry for 32 years, in which I have served in many countries. I wouldn't go into the details. For this audience, I would go into some of the work that I've done on climate. In COP27 in Sharm el-Sheikh, I was the chair of Group of 77 in China, and we were the ones who pushed for establishment of the Loss and Damage Fund. Then in the next two COPs, COP28 and 29, I was chairing one of the subsidiary bodies of COP, which is a subsidiary body on implementation. And I did work on the GST, which is the global stock take, one of the major things that we did in COP28. And then in COP29, the NCQG, which was the new collective quantified goal on climate finance. And among many other things that we did for implementation of the decisions of COP. So this is some of the background. Look forward to interacting with all the colleagues today. Thank you.
Thank you, Ambassador Munir. With this wealth of experience, perhaps all the difficult questions we will save for you. So be prepared for that one. Over to you, Ina. So Ina Sachi, very welcome to Pakistan. Welcome to this panel. Over to you. Please briefly introduce yourself.
Your Excellency, honorable guests here in this room and online, it is really a pleasure to be here. My name is Ina Sachi. I'm a senior vice president at the company called University Research Company. And we have been established in 1965. So it was a group of university professors that came together at that time, and they made a decision that it's important to look for evidence and bring that evidence into development space. So we are guided by that evidence rather than doing a guessing game. And I believe many of us are using evidence when it comes to making important decisions. So I'm proud of the company that I represent. A little bit about myself. So I'm a nurse and educator by training. I am overseeing a large number of programs and activities within the region. Most of our work is in Southeast Asia. It includes countries like Myanmar, Cambodia, Philippines, but we also have been active in Pakistan and in Bangladesh and in other countries that are outside of this region. A little bit more about URC. URC is known for its work in continuous quality improvement and health system strengthening. Oftentimes, we talk about improving access to healthcare services without thinking that if quality of services remain the same, that have that access is simply not enough. So there's a lot of efforts that need to be done in order for the services to be at the right level. And that's what we've been doing over the past 3 decades. Other areas where we have been known for worldwide would be health system strengthening, very similar to PATH. But in addition to that, we've been focusing on infectious diseases, malaria, TB, and of course, HIV, AIDS, depending on what the emerging issues are calling us to do. But another area that is quite important and where we have been very prominent is mental health. So mental health and psychosocial support, it's something that not many organizations have experience with, don't know how to start the conversation, but it's becoming more and more of an important subject, especially when we talk about creating more resilient systems. So I am looking forward to this panel discussion with such honorable members of the panel, and I hope I will share the experience from URC worldwide and within the region, and also learn from all of you. Thank you.
Thank you, Ina. We are proud partners of your company. As you said, that you're proud of what you do, and we are equally proud of what we do together. So let's quickly move to the 2 short presentations. The first one will come from Dr. New. She'll tell us about our work in One Health, which she has been leading for quite some time. So 5 to 7 minutes, because you have seen we have very powerful and distinguished panel. We are short of time, so please keep it precise. 5 to 7 minutes. Dr. New, over to you.
Thank you, Dr. Nabil. Should I share the screen or can you
Yes,
see
I
my
think you have the
screen?
full access. We can see your screen and we can see your PowerPoint presentation as well.
Yes, thank you.
Yes,
Good
you're on the
morning.
slide. Yes, fantastic.
Yes, you can see now, right? So thank you very much for the opportunity to present today. I would like to share experience of the national level, example from Cambodia, and from sub-national level from Vietnam on the One Health structure, the governance, and the proposed operationalize One Health in practice. So as you know that why we need One Health investment, because there is accelerated pace of emerging infectious diseases increasing at the annual rate of 6.7%, and 75% of EID, emerging infectious diseases, come from animal. So looking at human diseases, we cannot ignore animals and animal disease and going to jump to human. And it have a big impact of income loss because of pandemic, and the example of COVID-19 pandemic recently, that with World Bank's estimate of nearly $500 billion loss. And pandemic risks actually can reduce at the source by addressing disease driver at human, animal, and ecosystem interface. And One Health is a necessary foundation for health security. Antimicrobial resistance. There is a WHO estimate of nearly 10 million deaths by 2050 if we don't do anything at this moment. And there is a tragedy of the common overuse and misuse of antimicrobials in human livestock, fishery industry, and crop production that cause AMR, and substantial GDP loss of 5.6% estimate. So addressing AMR can be highly cost effective and have a high return for investment for 88% per year. And human and veterinary health system need to work together to tackle and combating to AMR. And multi-sectoral action plan for AMR with One Health approach is an avoidable approach and solution. A little bit about Cambodia context as an example from Cambodia. In August 2023, the Prime Minister signed the decision to set up Inter-Ministerial Coordination Committee for One Health, called IMCC One Health. And because of that, KW decided to invest 34 million euros for the 5 years, supporting One Health system and operationalization in Cambodia. And part was the feasibility study assessment consultant for these projects. And we propose to have governance leadership based on IMCC One Health. And under that is a One Health data platform as the skeletons for data-driven decision makings. And the foundation are the 3 key ministries, Ministry of Health, Ministry of Agriculture, Forest and Fishery, and Ministry of Environment. So we collaborated with key stakeholders, international donors, and government sectors, and proposed the One Health approach in Cambodia, including operationalizing One Health in Cambodia via the capacitating the IMCC One Health, via the institutionalized One Health in each core ministries, and capacitate the provincial One Health Center of Excellence, and pick AMR as the demonstrations of how One Health system work at both national and sub-national level. And with the investments from KW, but also from many other donors and local governments, really want to support Cambodia to become an exemplar for One Health approach and demonstrating Cambodia readiness and resilience to epidemic and pandemic. Another example I'd like to highlight is the model at subnational in Vietnam. We propose the Provincial Center of Excellence for One Health approach to be the overarching methodology to link, sustain, and localize activity and approaches in all 3 sectors, human, animal, and environment sector, including climate change. And it should be the very flexible approach that adapted for each province current capacity and gaps. But it has to go with the framework, and the Provincial One Health Committee is the highest mechanism level that chaired by the People's Committee in Vietnam, who is the highest authority, with the composed key member from 3 sectors and other department in the province, as well as the private sector engagement. And underneath that, it would have a technical working group on prevention and risk mitigations, on zoonotic disease, emerging infectious disease surveillance and information system, and very important, risk communication, community engagement, and private sector engagement. And how it operationalized the One Health structure under the surveillance system, indicator, event-based surveillance system in human and animal health, the rapid response team for One Health at community levels, private sector engagement, and risk communications, as well as guideline and tool. And the final slide, it is example of part assess the current information system at the subnational level. With 4 levels, we propose to support the model of One Health operational at subnational level. Data feed in from apps in the community, go to the data source with different surveillance system, digital surveillance system in Vietnam. And then it fit into the provincial data hub housed by human, animal, and environment sectors. And finally, data translate into the dashboard for data-driven and for policy decision making. Thank you very much.
Thank you, Dr. New. Dr. New is very soft-spoken, but very quickly, a few words about her. She's a medical doctor, and she has a PhD from USA as well. It has been an absolute pleasure working with her. When I started building this climate change and health program in PATH, she was my first port of call. because I got to know that in the last couple of years, she has brought $100 million to Path's portfolio for some of the projects which she has done. So together, we have worked on the Vietnam project. It was a $22 million US grant, which we received. And now this Cambodia project, I hope we have started it. It was supposed to kick off this week or last week. It's a 34 million euros soft loan to government of Cambodia, which we have designed in climate change and One Health. Thank you once again. We will hold our questions for now. Dr. New, you are with us, but we are moving swiftly to Dr. Marukh now on climate change and air pollution in Pakistan. Over to you.
Just to confirm, can you see the screen? Hello?
Yes, we can. Yes, we can.
We can see
Okay.
your last slide, actually. You may want to go to the first slide.
Do you want us to run your presentation from here? We can do that as
No,
well.
I think I can. No, I think I can.
And it starts somehow from the end. Please scroll up.
Okay, so
You may like to go to the presentation mode.
yes, yeah, it's working here now.
Okay.
So thank you, STPI and PATH, for giving me the opportunity to talk about an important public health matter. To put it plainly, the air Pakistanis breathe is now one of the greatest threats to our nation's health and economic stability. When cities consistently rank among the most polluted in the world, it's not an environmental issue, it's a full-scale public health emergency. Air pollution has direct impact on health of our people and economy of the whole country, consequently affecting the quality of life. Pakistan ranks consistently among the top 5 most polluted globally, with urban PM 2.5 concentrations routinely exceeding WHO guidelines by a factor of 15 to 20. The implications are severe. Recent studies, including the Air Quality Life Index, indicate that air pollution reduces national life expectancy by nearly 4 years, a figure that rises to over 7 years in high-impact regions like Lahore. Economically, the World Bank quantifies the cost at approximately 5.8% of GDP annually, driven by healthcare expenditures and lost productivity. This establishes air pollution as a critical strategic bottleneck to sustainable development. The genesis of this crisis is multisectoral. The transport sector is the single largest contributor, responsible for roughly 40% of harmful PM 2.5 particles. Agriculture is a major seasonal driver. You can see here that it's the agriculture is giving right now only the 15% contribution, but during the post-harvest season, it becomes 40 to 50%. Federal government formulated National Clean Air Policy (NCAP), which was revised in 2023, while among provinces, only Punjab has a Clean Air Action Plan formulated in 2023. Among the sectoral projects designed to improve air quality in Punjab include addition of new fleet of electric buses in Lahore. This is a pilot project just like smog cannons and smog tower installed in Lahore. In agriculture and forestry sector, subsidies for 10,000 happy seeders machines are planned. 5,000 machines are already given. Also, introduction of climate smart agriculture techniques and previous campaigns of 100 billion tree tsunami are commendable. Similarly, Qaid-e-Azam's solar park project and Bhasha Dam are going to help replace the fossil fuel with cleaner energy. Additionally, in the industrial sector, drones are being used in some areas to identify illegal industrial polluters, while over 70% of the estimated 20,000 brick kilns in the Punjab have been converted to cleaner zigzag technology. For continuous monitoring of AQI, over 100 real-time air quality sensors are installed across Punjab and other provinces to improve data-driven decision-making and public alerts. While these steps are not enough, and we still need to do a lot more, let's have a look at how China made an improvement in just a decade. So actually just a decade ago, this year, air pollution in many of the China's major cities was a defining global image of its rapid industrialization. The term smog became part of the daily vocabulary. Recognizing the severe environmental and public health crisis, the Chinese government declared a war on pollution in 2013, launching its landmark Air Pollution Prevention and Control Action Plan. This wasn't a minor policy adjustment, it was a top-down, systematic, and unprecedented national campaign. The strategy was multi-pronged. First, they tackled the primary source, coal. They began a massive program to replace coal-fired boilers with cleaner natural gas or electricity, especially for winter heating in northern cities. Second, they went directly after industry, enforcing the world's strictest emission standards and forcing the closure or relocation of thousands of polluting factories. Third, they transformed the transportation sector, not just with stricter vehicle standards, but by becoming the world's largest market for electric vehicles, creating a powerful domestic industry in the process. Crucially, this wasn't done city by city. They created a coordinated framework for the most polluted regions like the Beijing-Tianjin-Hebei area to ensure one city's progress was not undermined by its neighbors' inaction. This slide sets the stage for the rigorous implementation that led to the remarkable results we'll see next. The results of this concerted effort have been nothing short of dramatic. The most critical metric, PM2.5, those fine particles most harmful to human health, saw the national average concentration cut by more than half in less than a decade. This is one of the fastest improvements in air quality ever recorded. Let's take Beijing as a case study. The city that once made global headlines for its air apocalypse has reduced its PM2.5 levels by over 60%. This isn't just a statistic, it's a tangible change in daily life with significantly more blue sky days. The public health benefits are immense, with studies crediting these policies with preventing hundreds of thousands of premature deaths. Furthermore, this environmental push had a strategic economic upside. It forced innovation and scale in solar, wind, and particularly the EV industry, positioning China as a global clean tech leader. However, the work is not done. As particulate matter declines, ozone pollution is emerging as the next challenge. The long-term goals for carbon neutrality by 2060 are now the central driver, locking in the need for a clean energy transition. The key takeaway is that China has demonstrated that with strong political will, systematic planning, and massive investment, rapid improvement in air quality is achievable, even for the world's largest manufacturing economy. Drawing from this international best practice, I propose a 5-pillar framework for Pakistan. Number one, we have to strengthen the governance and enforcement. And for this, we must transition the UNCAP from an advisory document to binding legislation, establishing an independent regulatory authority with enforcement capabilities. Then transport sector should be modernized. This requires a mandated rapid shift to Euro 5-6 fuel standards, a phased ban on high-emission vehicle imports, and a comprehensive policy package to catalyze the electric vehicle market. Industrial and agricultural sector should be reformed. We need to set and enforce a non-negotiable compliance deadline for brick kiln technology conversion and de-incentivize crop burning through subsidies for mechanized harvesting and residue management. We must invest in data and transparency. Investing in national real-time air quality monitoring network is essential for public accountability, targeted action, and evidence-based policymaking. We must mobilize green financing, which means we must proactively develop bankable projects to secure concessional financing from multilateral development banks for this critical infrastructure transition. In conclusion, the evidence is unequivocal. Addressing the air quality crisis is a non-negotiable investment in Pakistan's human capital and economic competitiveness. The blueprint for action is clear and proven. The cost of inaction, myriad healthcare burdens, diminished cognitive potential, and stunted economic growth far outweighs the required investment. Our path forward demands a paradigm shift from fragmented initiatives to a coordinated national mission. It requires unwavering political commitment, cross-ministerial collaboration, and the strategic reallocation of resources. By acting decisively, we can safeguard the health of our population, unlock our economic potential, and fulfill our commitment to a sustainable and prosperous future for all Pakistanis. Thank you.
Thank you, Marukh. Very comprehensive study indeed. We will quickly move forward to the panel discussion. So Hadia is going to kickstart. She is the rising star of PATH, I must say, based in London. We are working very closely together. Over to you, Hadia.
Thank you, Dr. Nu and Marukh, for those presentations. That gives you a bit of a flavor of the work PATH does. So we have an excellent panel with us today, ranging from academia, global health leaders, governance, and more. So I think to start off, maybe we would like to ask the entire panel, what would be your perspective on the intersection of climate and health and how this is evolving in Pakistan? And also, in what ways is Pakistan already taking a step forward in the public health space, whether that may be to do with service delivery or disease patterns or community resilience? So maybe I'll start with Ambassador Nabil, if you would. Floor is yours.
Thank you, Hadia. Well, how does climate change impact health? I think that's a question that we have. I've just put on some points and a few statistics to show how it works. Well, the impact on human health through air pollution, extreme weather events, displacement, food insecurity, and diseases is quite obvious. What one of the earlier presenters presented on air pollution is something that is very emblematic. What happens here is that every percentage point or AQI number that increases, health decreases. It worsens waterborne and foodborne diseases. It changes temperature and precipitates, aggravates the spread of vector-borne diseases. Climate-induced heat waves result in increased heat strokes, deaths related to cardiovascular and respiratory diseases. Intense rainfalls due to extreme weather events causes injury and death directly, as well as diseases through hepatitis, cholera, malaria, diarrhea, and so many more. Scientific evidence attributes 37% of heat-related deaths to human-induced climate change. Heat-related deaths among those of over 65 have risen 70% in the last 2 decades. Without preventive action, deaths from such diseases, currently around 700,000 annually, are expected to continue to rise. WHO projects 250,000 annual deaths yearly by 2030 due to climate change impacts. And health systems are directly impacted by climate-induced disasters. They destroy health infrastructure, healthcare services, supply chains, and of course, essential health products as well. So all of that means that if we are not able to reduce the impacts of climate change, if we are not able to reduce the pollution that is plaguing our cities right now, the number of deaths is first, the number of people that are going to get sick is going to rise, and of course that will lead to number of deaths rising as well. There will be a major impact on our healthcare infrastructure, and there will be a major impact on the quality of life that we have. Thank you.
Thank you, Ambassador Nabil. Over to you, Ms. Sina.
Well, thank you so much. As I was getting ready to come to Pakistan, and I have to admit, this is my first time, I was having a conversation with my friends and my family about what is the reason why I'm here. And I said I'm going to be part of the panel that will talk about climate change and health. And they looked at me like I was crazy because they said, we don't see the connection. And I said, what? And then I said, now you have to listen to me. And I gave them the lecture. So I'm not going to do that with you, but I actually think it was an important takeaway from this dinner conversation for me and for all of you. People don't see the difference it makes when we invest in preventing climate change consequences, when we build more resilient health systems. They don't see the connection between climate change and the burden of diseases. We do. We need to make sure we can talk about that, and we can talk about this in the language that people can understand and relate to. And that's the most difficult part, because we get to be too scientific oftentimes when we talk about the issues that are important and close to our heart, and we miss a lot of our audience. So find a way to make it more simple is really critical. So, and as I was reading all the statistics and learning about Pakistan, it was devastating to see the trajectory of the climate change and how it is marked by repeated floods and extended droughts and also the heat waves. And who is it impacting the most? Of course, the most vulnerable. Who are the most vulnerable? These are women, children, and the elderly. That's the future and the legacy of this country. So what we need to do is find the best way to protect them. And again, so if we look at the pathways, as Ambassador already pointed out, we can see the numbers, and the numbers are telling us the story. The numbers are showing to us that there is a rise of diarrheal diseases. Diarrheal diseases are one of the key contributing factors to child mortality. So, and that's a preventable disease. So if we're well prepared for that, we know there are solutions that we can introduce that the whole country can benefit from. Then we see the rise of stunting, and we know that wasting is not far behind it. 40% of children under 5 in Pakistan are stunted. These are the numbers you hear every day, but what are the contributing factors to the stunting? It's the droughts, it's the floods, because there are not right crops that are being grown, and there are not enough money in the household to feed the children. When we talk about the numbers behind the stunting, it's also remarkable to understand that 35% of stunting is contributing to child mortality as well. So we always think about stunting, it's that children are short of stature, but it's much more than that. It's really important that we look into this. And then, of course, more floods bring more mosquitoes. Mosquitoes bring diseases. Mosquito is #1 killer in the world when it comes to bringing diseases to people. So they bring dengue, they bring malaria, they bring other mosquito-borne diseases. And again, women and children will be the most vulnerable. Maternal mortality will be impacted as well, because women need to have access to healthcare services when they're pregnant. So health workers need to get to the healthcare facilities to offer the services that they bring. So all these women cannot get the antenatal care, postnatal care, and a facility-based delivery support that they are very much relying upon. And last but not least, of course, heat impacts severely elderly people, cardiovascular diseases, as Ambassador already mentioned, and we need to be aware of that. It overwhelms the healthcare workforce, so it overwhelms community health workers that are serving primary healthcare facilities, hospitals, and at all levels. And that's when we can see also how it's impacting the mental health. People cannot work nonstop. Someone needs to be thinking about this. So that's what I saw, and I think there's a lot to think about, and a lot has been done, of course, already in Pakistan, but there's more to do in order for us to be best prepared to face the situation.
Thank you, Ina. Moving to our colleagues online, starting with Dr. Bhutta, from your perspective, how do you make sense of the intersection of climate and health in the Pakistani context?
So thank you very much. And I'm afraid I'm going to have to step off after this comment of mine because it's midnight here, and I have a very early morning start tomorrow. So let me just say that, my colleagues have already told you very clearly how does climate change impact health. I mean, there are direct effects and there are indirect effects. The direct effects can come through the pathway of disasters, floods, extreme heat events. The indirect effects also come through things like crop productivity and many of the elements that people have talked about, including impacts on disease burden. But the important thing to reflect on is that almost all of these effects are modulated by social dynamics, things that are pre-existing. So if you have gender inequity, if you have differentials in poverty and access, if you have missing public health infrastructure or health infrastructure that is not as resilient as it should be, then all of these effects are compounded. And quite unlike what people might consider, many of these effects are actually much worse amongst the urban poor because they do not have the living conditions that allows them to build adaptation and resilience. So in a nutshell, we now know that particularly climate change impacts that relate to extreme heat events, exposure during pregnancy in vulnerable populations, and also things that relate to mental health and non-communicable diseases are disproportionately clustered amongst the poorest of the poor. We published an analysis very recently, just a few months ago, about the risk factors that included some ecological factors for stunting and wasting among children in Pakistan. And apart from things that many people know about, poverty, food insecurity, things that impact the first 1,000 days, as my colleague Professor Ikrar was talking about, what is very clear is that independently, extreme heat exposure at a geospatial level within the areas and clusters where stunting was identified is an independent driver. So certainly these factors have not been recognized, have not been known essentially over time. And of course, we all know what has happened with successive floods in Pakistan, with the impact that it has had in populations on mental health and its consequences. Now, I mean, it's one thing to recognize and so-called admire a problem. It's quite another thing to actually do something about it. And I think it is very clear now that many countries, including ours, despite the fact that we probably have not had a massive contribution ourselves to the crisis that we face, will have to deal with it ourselves. COP30 has started. It's now been 2 years since the Loss and Damage Fund was created. It has had hardly any funds, and we would be lucky to get a few $1 million out of it. So Pakistan government, civic society, philanthropic organizations, and many of us in science and academia will have to find indigenous solutions. And those indigenous solutions need to come from not just indigenous knowledge of adaptation and resilience over time, but also need to come from the best evidence. So a lot of my group's work over the last few years has been in trying to find indigenous solutions that work both in terms of structural adaptations, things that we can do within health systems to improve care for women, children, and most vulnerable, things that can be delivered for addressing mental health issues through our existing health workforce in community and outreach settings. And all of those things need to be done at scale. And the last thing that I would say is that the eye does not see what the mind does not know. We know of many issues related to climate change in Pakistan in the aggregate because these massive, large figures are put out, but we don't have a very clear sense of which are the populations that are disproportionately impacted by climate change. If you look at some of the geospatial heat maps of Pakistan, you would realize that it's really populations in deprived provinces and potentially provinces that lie in Balochistan, southern Punjab, and Sindh, those areas that have borne the extreme brunt of heat impacts. But floods affect populations everywhere living in the riverine areas. These recent floods, I'll just finish with this one comment, has really highlighted and underscored how important governance and oversight is. Because a lot of the disaster and destruction that happened was principally not because we couldn't have done anything about it, but because we did not learn the lessons from previous floods in terms of what building rules, regulations, structures, oversight, and mechanisms need to be put in place in terms of ensuring that people are not put at disproportionate risk. So I think all of those things are important, and they need to be put in the context of practical implementation strategies. So I greatly appreciate SDPI and PAT's effort in this regards. I wish that I was in Pakistan in person with you, but rest assured, we have a symposium at the end of this month, which is principally on structural adaptations, on what needs to be done in terms of both building conditions, regulations, both in urban and rural population. That symposium is at Aga Khan on the 28th and 29th of November. And I know SDPI will participate, and we would welcome PAT's participation as well. Thank you.
Just a quick interjection. Thank you for your wonderful expose, Dr. Bhuta. Can I take 2 minutes of your time? I know it's midnight. You have given your life to women's and children's health all your life, and you have talked about vulnerable groups. You talked about slums. You talked about some of the areas. Would you like to enlighten us a little bit on women's and children's health, how they are affected, and what needs to be done? What kind of innovative solutions are there globally in that space where Pakistan should focus? Thank you.
Well, obviously, a lot of the interventions, Nabil, that are there for improving women and children's health are also interventions that will prevent a lot of the consequences of undue exposures to ecological factors in the first 1,000 days, as Professor Ikrar will no doubt talk about. So I think improving nutrition in utero, in pregnancy, ensuring that babies who are exposed to heat do not have growth retardation, as we know they have. And if they are growth retarded, as we know they are, they also have impact on child development. What we haven't spoken about is the very important relationship that extreme heat, climate change, and importantly, air pollution has on children in schools, in learning. We estimated last year that a significant quantum of the impact of climate on the whole learning agenda and children's education in Pakistan was because of premature closures. Either schools closed because it's so hot, or schools closed because the air is impossible to breathe. If you put that all together, the net consequences of this on national development, on human capital, are massive. So no wonder the Minister of Finance is now saying this is an existential crisis for Pakistan. So efforts in terms of doing something for health, women and children's health, will bear intergenerational benefits. Every baby born low birth weight because of exposures in utero, either to noxious environmental stimuli or to extreme heat, is a baby which has a potential loss of developmental potential over time. And that has an intergenerational cycle over time. It doesn't take rocket science to work this out, but the associations really now require solutions and interventions. One such intervention is the inclusion of nutrition within the social safety nets in Pakistan, the nutrition support program that we have, the BNP program. And already we have evidence that it does make a difference where it's given, and I hope it can be sustained.
Thank you very much indeed. Dr. Abid Suleri knows it is midnight in Canada. He knows very well, just stepped in. So welcome, Dr.
I'm sorry, I have a very early start tomorrow. Otherwise, I would have stayed, Nabil, as I told you a couple of days ago. and Adia, but I mean, I have a delegation visiting at 7 a.m. tomorrow, so I will have to beg your leave. Thank you.
Thank you very much. Could we give you a big round of applause before you go to your bed?
Thank you.
Thank you, Dr. Bhutta. Same question for Dr. Ikrar. From your perspective, how do you make sense of the intersection of climate and health in the Pakistani context?
Well, I would like to take the logic further from Dr. Bhutta's presentation that learning and we fail to learn. We have been facing climate vulnerability since 2010, every year in a different location, with a different intensity and with multiple consequences. And first years, 2022 and now 2025, we've seen the losses in the form of crops, food insecurity, livestock, and then the disease epidemics. We have also seen the effect of climate on human migration. There are public organizations like NDMA, PDMA, which are good at emergency response, but actual casualty begins after emergency response, during the rehabilitation, or to return the life back to normal. So in my specific case, I've been focusing on crops and livestock as a measure of food security. And we have done some work on adaptation by defining agroecological zones. And the FAO has been our partner. We believe that our current agricultural advisory system is generic, whereas much more precision is required. And to bring that precision in, you need data analytics. So data-driven precision agriculture is one way of responding to climate change for food security. But then both in crops and livestock, which are our food security measures, heat is the major challenge now. On an average, 2 Celsius harsh temperature faced by crops, particularly our staple, which is wheat. We have seen serious consequences of high temperature, shocks during grain formation, and leading to disease as well as poor yield outputs. So considering that as a challenge, two streams of technology are now under test in collaboration with the many partners in North America and other international agriculture research system partners. We believe that we have enough genetic plasticity to introduce heat-tolerant crops. We're also talking in terms of bringing in new crops. And in Pakistan's food security, particularly the protein food security, is thanks to broiler chicken and poultry, which is affordable and accessible. And one of the key elements for that broiler chicken and poultry is soybean. And unfortunately, Pakistan does not grow soybean. So the entire system is dependent on imported soybean. If there is no soybean, you will not have, chicken to eat. So we have made concerted effort during last 1 decade to bring in soybean as one of our leaf crop. Wherever there is corn grown, soybean can be grown. We are surplus in corn and we are importing soybean. Then a few words about One Health initiatives, which I initially introduced my, take on that. We are here with a very elaborate system of public health research and training programs. Our people are working on zoonosis, vector-borne diseases, particularly dengue and ticks. And ticks in the livestock are not only causing morbidity of the livestock, but also they are vector of some of the very significant diseases, both for an animal and human. I have another take on One Health, which is radical and generic definition of health. One Health probably doesn't look into that. In Pakistan, two biggest micronutrient deficiencies are zinc and iron. And if you look at the ecosystem as a whole, and if we go by historic data, my parents had no zinc and iron deficiency. People of my age also have very little iron and zinc deficiency. But the next generation is, across the board, iron and zinc deficient. And there's a strong correlation of this iron and zinc deficiency with soil health, because our food comes from soil eventually. And it is the soil which has become zinc and iron deficient, or probably not deficient, but unable to provide the zinc and iron required by the plant, which is our food. We take plant food directly, or we feed the plants to animal and then take the animal food. And across the board, there is zinc and iron deficiency, which is strongly correlated with soil health. Soil health in terms of its chemistry and physics. And the chemistry of nutrients is that it's very positively correlated with the soil pH. High pH basically binds micronutrients, and plant roots are unable to absorb those micronutrients. So we are working on this ecosystem approach of making sure that zinc and iron deficiencies are addressed. There are also genetic approaches, particularly GM crops and high zinc and high carotenoid crops. The carotenoids in Pakistan, somehow there is a regulatory deadlock. The word is growing GM crops. We are consuming GM crops from all over, but we are not growing them. So we are also discussing this science question. There's anti-science attitude, or our inability to actually prevail upon that attitude. So there is a room for discussing the use of genetics to overcome some of these challenges which are posed by climate to our health. The heat, the air pollution, and then the nutrient composition of our diets. So these are some of the areas in which I'm trying to, build teams, and we're seeing a bright future. Thank you.
Thank you, Dr. Khan,
Thank
for
you.
sharing your experience, expertise, as well as wisdom, I would say. You said it's radical, but perhaps this is the right course of action for all of us. We talk about One Health, but we often miss the strategic part of it, which is the soil from where everything starts. So I think we will try to bring that into the loop as well. So that's my big takeaway from this conversation. Thank you very much once again for sharing your thoughts with us. Over to you, Hadia.
So I would like to ask Dr. Nu the same question, but I would like to reframe it a little bit. And it's a good segue from what Dr. Ikrar has shared with us as well. So we've heard a lot about what different leaders are doing in this space at the intersection of climate and health. You have led a lot of governance-related and system-oriented approaches to climate and health. So from your experience in East Asia, maybe we can hear from you on how we can take some learnings and possibly look at them in the Pakistani context, and any best practices and your experience working in East Asia that we can apply here.
Thank you very much for great questions. From my experience working in Vietnam, Cambodia, and also some in Indonesia, I see there are three elements critical for this to operationalize climate change and how to be in practice to be addressed. One is the political will and commitment from leaders. It's very important. The second is the coordination mechanism that mandated with clear role and responsibility. I witnessed the coordination mechanism established, but often health sector being very predominant. So really have this work on climate change and how to human and animal to be addressed. I think the roles of animal health sector and environment sectors is very critical. I witnessed like Indonesia, they have a Ministry of Coordinations who is in the middle and coordinate on the role responsibility of different sector, health sector, animal and environment. Or in Cambodia is IMCC One Health as I present. Or in Vietnam is just One Health Partnership Consortium. And I see the Prime Minister level mandate and clear, authorize and divide the responsibility between three sectors for this coordination is very key. And from national level, provincial level and subnational level need such mechanism as well. And finally is the finance and partnership. Finance, I mean, it's not international partner and donors. The finance should seek majority come from the governments, central or local government, and also to like mobilize funding from private sector and community. It is very critical for sustainable. So now how to operationalize this? From our experience, we see the public health emergency operation centers used to be the concept very successfully implemented. Is the model recommended by US CDC and WHO, where on the public health events to be hosted at the Ministry of Health, but collaborate with other ministries to early detect outbreaks, epidemics, and coordinate for rapid response. But I think to address this for further up level, we need to address food security. You need to address air pollution, heat stress, storm, flooding, and drought. It's more than just responding to epidemic of infectious diseases. So that's why we recommend the climate change and house, or like say one house mechanisms, level up and led by highest level of government authorities, and they should invest on this. And the data, One Health data platform as skeletons to operationalize this. And I want to emphasize a lot of governments, the impact of this climate change in the world, in other country. But once we have and collect and present the data and evidence from local, from Pakistan, that would be much more powerful to negotiate and to have the political commitment and decisions to invest in this area. And then for that platform, we have data on the impact of the climate change to human health, animal health. We have the impact on the food security and many other aspects as well. We can have data for forecasting and preparedness. To predict the upcoming flooding storm, or the forest coverage is reductions significantly in this area, and that might affect. So those is very critical, and it never have been before, and share between different sectors to really see the link to the consequence in human and in animal. And we also need data to target the area when the events happens, who affected the most, and how to mobilize the resources both at local and subnational level to respond to that. I think that it's very critical for this mechanism, the protocol, the SOP, and visualizations, and the leader sit together, looking at the data, discuss the solution, and decide on building the capacity at the subnational level, being prepared, readiness, and response. Thank you so much.
Thank you, Dr. Nu. There's a lot of different points you touched on that make a lot of sense. Governance, financing, data all have to go hand in hand. Ina, similar question to you. Based on your experience, what are some promising practices or innovations from your global perspective that show climate and health could be tackled together?
Well, thank you so much again. And I'm going to be brief because there are quite a few other speakers and we have very little time left. And I know when we talk about climate change and health, we oftentimes start the conversation with the diseases, and that's exactly what we did. But then we really need to think about going beyond the burden of diseases and need to think about building resilient health systems and systems overall, healthcare systems that coordinate with different parties at the government level, at the civil society level, and also at the community level. So, and then to truly build resilience, we need to focus on systems and people and livelihoods that sustain health. And at URC, what we have learned, it helps us to be more strategic when we take a systems approach. And the systems approach that recognizes that healthcare is part of living ecosystem that is under constant stress. So climate change is here to stay. So what we need to do is think about how do we design the systems that are best prepared to face it. Our work in climate change focuses on people, systems, and services. We believe that these are the three most important components. When we talk about people, of course, we talk about people from all different angles. Number one, it's the patients that healthcare facilities, health services are being offered to, but it's also the health workers. They are at the core of everything that we are doing. We need to make sure we engage them as we are redesigning, reimagining our new, very resilient health system. So we also need to make sure we get them to be part of the conversation to build trust, to ensure we also have healthcare providers that are well-trained and supported by the entire system. Either it's coming from the Ministry of Education or the Ministry of Health or Ministry of Infrastructure or other ministries that are part of the system, ecosystem here in Pakistan. They need to be part of resilience building. We need to think about expanding access to high quality, safe and effective healthcare services where patients come first. And when we are thinking about expanding access to healthcare services, we need to think about beyond physical access to healthcare. Because I've seen the numbers from the recent flood from 2022, almost 10% of healthcare facilities in Pakistan were destroyed. What it means is that health workers had no place to deliver services. It also means that patients had no place to come to receive healthcare services. So there are solutions that we applied in different settings that introduced mobile clinics that were equipped with community health workers, with nurses and midwives who were able to get to the people who were in desperate need of these type of services. But there are other type of solutions that we can be looking at with the help of digital technology. So telehealth is here to stay. So now we have so many different ways on getting in touch with our patients when we are at the service delivery end. We need to find the ways to bring it here in Pakistan. We can offer antenatal care to women who cannot get to healthcare facilities with the help of mobile technology. There are devices and there are applications in Canada that help very busy physicians to measure children to make sure that they grow well. So, and that's really an important indication of stunting. So why can't we have these type of very simple solutions on our smartphones that can offer that kind of benefit to the people that we serve. And last, to talk about the services themselves, we need to think about how do we modernize the system. So we already heard about investing in financing, investing in governance, but we also need to make sure that all of these investments are touching upon developing efficient, resilient, and accountable systems across different sectors. So collaboration is really critical. I'll stop here. And I can talk about mental health, but that's a very different and very lengthy subject. Don't want to take all your space.
Thank you, Ina. So I'm hearing from Dr. Nu and from yourselves that we need a systems approach, and this is something that needs a coordinated response from not just Pakistan, but also regionally and internationally. So that brings me to my next question for you, Ambassador Nabil. As these climate and health risks are intensifying in Pakistan, how does Pakistan envisage strengthening collaboration with other countries to address these shared challenges?
Thank you, Hadia. And yes, I think as all of you know, Pakistan's contribution to climate change is less than 1%. Yet, as we've been all discussing, the impact of climate change on us is huge. We are one of the most climate impacted countries in the world. We have been actively and constructively engaged with, for example, negotiating and drafting the WHO pandemic agreement. And we have also targeted amendments to the international health regulations. We welcome the adoption of the agreement, and we hope that these are the kind of things that will help us move forward in better, resilient health infrastructure, as well as availability of resources as we go on. We have always reaffirmed our commitment to the 2030 agenda, despite the fact that some of the countries are now walking back from it. And we are working with the international community to make sure that the achievements, especially on the SDG 3, which is good health and well-being, they are not only globally imperative, but they are also deeply embedded in our own national development agenda. So we are trying to make sure that whatever we are committing outside, we are trying to bring them inside. And for example, the SDG 2030, when it was adopted, Pakistan was the first country who had it part of our 5-year plan. We can always argue whether we are implementing the plans or not. That's a problem, and that's an issue that we've got to collectively address. But at least the planning cycle includes all the things that we are supposed to do. Then the global health architecture, which is based on equity, solidarity, and cooperation. That is an essential human requirement. I think that's what we need to work on. And when we talk about, in terms of climate, the concept of CBDR, common but differentiated responsibilities, that is which gives us that edge as a developing country that we require. Because whenever we talk about any impact of climate change, whether it's health or any other, it always boils down to finance, climate finance. And that climate finance right now is very limited. And Professor Bhutta is not here anymore, but he also referred to it that, for example, on loss and damage, we worked so hard for decades. We got it. It has a total kitty of only $300 million. And out of that, 50% is for LDCs and SIDS, which means $150 million for all of the rest of the developing countries, while impact of just one flood in Pakistan in 2022 was over $20 billion. So we have to find indigenous solutions, and that's the only way forward. Thank you.
Thank you, Ambassador Nabil. I will pass the floor back to Dr. Nabil.
Right.
Yeah.
Well, thank you very much. I had not expected that we will attract so much attention to this session. Great to see full house, so much wisdom, so much experience, which we have learned from our distinguished panelists. It'll be a great remiss if we don't give audience a chance to ask at least one or two questions. We're almost at time. So if you have a quick or burning question, raise your hand. If you think that, we must take that question, stand up and tell us that, you have that question. And then, okay, go ahead. Do we have a roving mic? Okay. Please be precise. And if this is a question for a particular panelist, just mention that as well. Introduce yourself.
Almost 429. And luckily I had a mask and I put on my face immediately. I understand that at government level, we are doing a lot on policy, funding, strategy, actions. But my question is, being a common citizen of Pakistan, what actions, what personal actions can I take or can we take to make our environment more human friendly? Thank you.
Thank you. We have a second question. Yeah, go ahead.
Assalamu alaikum. Thank you for the opportunity to share my thoughts. I am Muhammad Faisal, a microbiologist and public health researcher deeply committed to improving climate and health vigilance in Pakistan. Our country, especially regions like Kashmir, Sindh, Balochistan, Punjab, faces floods, heat waves, water contaminations, and poor healthcare access. Beyond short-term adoption, and we need long-term community-based systems that connect health and climate predations. But alongside this, how can we effectively tackle pollution from industrial waste to urban air quality to protect both people and the environment? Thank you.
Thank you. Two questions. The first one is on air pollution. So Ambassador Munir, to you and to Marukh on what we are doing is enough or not. On the second question, a very important point which we kind of missed a little bit, which was on the community engagement. So I'll go to Dr. Ikrar Khan if he's still with us, and also to Ina on that one. So could we start with Ambassador Munir?
Thank you. Since you started with a personal anecdote, let me start with a similar one. A few years back, I was posted in US, and after about 4 years in the US, when I came back, my son was young. He was about 10, 12 years old, 10, 11 years old at that time. And that was the first question that he asked. When he landed in Lahore airport, he asked me, Abu, how do we breathe here? So that's actually when you're living here, we are breathing here, we don't really fathom what's going on. When you come from abroad, after living for some time abroad, you realize that the air that we breathe is so thick that it's actually becoming difficult to breathe. And the impacts that it has on our health are, I mean, you can only imagine. And what we can do as ourselves, I think these are common sense things that everybody has to do, because we cannot leave it to the governments to improve our health. This is up to us as well. So, for example, if the car you're traveling in is giving too much smoke, you have to take care of it. You have to move towards EVs. It's very expensive right now, but that is the way forward. You have to make sure that the consumption that we have is sustainable. We are not using plastics as little as possible plastics. We have to make sure that the electricity that we use. And we have got, I think the Secretary General of the United Nations in September, he referred to Pakistan as one of the examples of going solar. 21% of our energy now is solar, which is amazing. And then that transformation has happened over the last 2 or 3 years alone. I will not go into why it happened, but it has happened. So let's take that win and let's move forward with it. We have to incentivize all of that, and we have to make, in our personal capacity, smart decisions, small, smart decisions, and that will help. Thank you.
Love it. Smart, small, smart decisions. And I think the point which was being made was that it's a responsibility of everybody. All of us are in it together, not only the government of Pakistan. So Dr. Marukh, if you're still with us, you're a specialist in this area. Please enlighten us, from your perspective. Over to you.
First of all, can you repeat the question? Because I think when she was asking the question, she had no mic, so I couldn't listen to the question.
So the lady is saying that when she landed in Pakistan, it was difficult to breathe. And she's of the opinion there are two things, if I understand it correctly, that not enough is being done in Pakistan. I saw some air pollution guns working in Lahore. So there are some small steps which are being taken. Are they enough? And the second point to my understanding was that what can a common man, a layperson, do to contribute to cleaning the air in Pakistan?
Thank you very much. So, according to my knowledge, my research, and my observation while living in China for the last 8 years, I believe, while I'm a Pakistani and I visit Pakistan once or twice a year as well, so I can truly understand the sentiments of anybody entering Pakistan environment, especially in the winter season, when the smog levels are very high. Like, as we know, like last year it was 1,000, 2,000, 2,500 in some major cities of Pakistan, like Multan, Faisalabad, Gujranwala, Lahore. So at an individual level, I would suggest obviously wearing an KN95 mask. It could be the first step towards, an individual protection. And then staying indoors is the second thing you can do. And third thing, I would recommend that the kind of houses you're living, you need to make sure that windows and doors are tightly closed if it's the smog season around you. So make sure you buy air purifiers for your houses, for your schools, for your offices. And then there are some indoor plants which like purify the air itself. So you can search for them. I'm sure Pakistan has plenty of agriculture, plantation. So you can buy them easily from any good nursery around. And then the very important point that I want to make here, that a lot of big people have talked about here about the undernourished children, vulnerable population of Pakistan. So I think during the smog days, we need to focus more on the nutrition of the vulnerable populations. I mean, for everyone, but I would say especially for the children, pregnant women, because if you have a strong body, strong immunity, you can fight the crisis well. So
thank you very much indeed.
Yeah.
Thank you. We're just over time right now, but I wanted to quickly go back to this wonderful question on community participation in some of those things, because we often do top-down things. So, Dr. Krar, over to you first. You're a specialist in this one. Over to you. What else can we do? What is being done, and what else can we do?
Actually, it is the power of education, capacity building, talking to people, onboarding, sensitizing communities is very important, and particularly the issue that he has raised, the industrial waste, solid waste management, and for us being able to look after ourselves and not looking for help from elsewhere. In Punjab, actually, the government has done a recently very good job of Saaf Suthra Pakistan, Punjab, Saaf Suthra Punjab. You can see the difference. But again, I think it has to be, linked with the community ownership. Otherwise, those are, PC1 projects, funds utilized, and then those initiatives disappear. So we need to really create ownership by the community. One thing that we have missed out, Nabil, is water pollution. We have talked a lot about air pollution. You know, you and I grew up in a place where there used to be open well and the water was drinkable. Now, nowhere the water, underground water, fit for drinking. Irrigation, of course, is another issue. A part of that is our misuse of chemical fertilizers and over abstraction of groundwater. And end of the day, this is affecting your overall wash requirement and public health at large. So addressing water and this overuse of chemicals in agriculture. Agriculture is the major culprit, I know that. And particularly the nitrogen fertilizer. The nitrogen fertilizer is polluting the aquifer, also releasing nitrous acid gas, which is climate offense. So, when the one health, soil health, water health, air pollution, all of put together is your challenge.
Points. Thank you very much indeed. Soil and water, that is life. And you have summed it up very well. You have 1 minute before Hadi and I wrap it up for today, I think.
Absolutely. So I would say community engagement is key. And what we need to do is make sure that they are engaged from day one, because they help us to design the system that address their needs. Oftentimes we come in from the bird's view and we give them the system that they don't need. They need something else. So let's make sure we get an opportunity to hear their voices. But then there is another very important component. These are community health workers. So they are the bridge between the healthcare system and the communities that they serve. So we need to make sure we invest in them, because they help us to be more resilient when it comes to climate change. They bring information and services to the communities that we serve. So they need two things from us. They need tools and information. So let's find the best way we can empower community health workers, invest in them, and help them to feel that they are valued, because they are the ones who can make a difference moving forward.
Thank you, Ina. Well, we started 10 minutes late, finishing almost 10 minutes late, but we took good 90 minutes, the time which was allocated to us. Thank you for your time, for your energy, for your attention, for your patience. My profound thanks to all the panelists for sparing the time for this one. And we'll take it forward from here. I know you have a question, but we can discuss it later. I'm going to stop here and pass it on to Hadia. Hers will be the last word, because I genuinely believe that it's the women and young people who will take Pakistan forward. So over to you, Hadia, before we do a big round of applause.
Thank you, everyone. Thank you to the panelists for joining us today. Thank you to SDPI for facilitating this session as well. I think we touched on a few different things. We touched on financing, governance, community engagement, a little bit about policy and what we're doing internationally as well. We had a few more questions prepared, but I think that really just indicates the depth and breadth of this discussion. I'm glad that we're having this conversation now. It's very timely. And I do hope that these conversations keep going forward and we actually translate these conversations into actionable next steps as well. So thank you to the audience as well. And yes, thank you to Nabil and everyone who has participated today.
Not this one, a big one, for the panelists and for the participants as well. We should finish with good energy, right? Thank you once again. Thank you.